Welcome to the Single Best Answer series from the UCL Centre for Anaesthesia. Don't worry if you don't know the answer straight away. They're meant to stimulate your learning and develop your critical thinking. If you'd like, you can discuss the single best answers with an anaesthetist in theatre. Press pause now while you read the answers. Press play when you're ready to see the correct answer. So the issues here are someone having a planned elective procedure. They're on beta blockers and analgesic agents. They look like appropriately beta blocked, heart rate 60 and blood pressure's okay. And it's also about fasting guidelines, isn't it? So you probably know no clear fluids. So black tea, black coffee, water from 2 hours before surgery, and no food for 6 hours. And food includes anything with milk in, by the way. So, you know, if you have milk in your coffee, milk in your tea, that's 6 hours. So immediately you can go and see what the, you can see the two options there, therefore, are 1, nil by mouth from midnight. Well, that would be more than 6 hours. But it also says take no usual medications at all on the morning of surgery, option 1. Now, we want people to have bisoprolol, beta blockers. They should be continued almost always. You should continue them. It'd be very unusual not to continue the beta blocker on the morning or the day of surgery, or have the night before if you normally have it at night. So option 1 is not true. Option 2, the fasting guidelines are okay, 6 hours and 2 hours, but omit bisoprolol on the morning of surgery, no thanks. Option 3 is not correct because it's got 4 and 2 hours. Option 4 is the correct answer because no solids for 6 hours, no clear fluids until 2 hours, and you'll take your normal drugs. The only drugs that we usually stop are, of course, anticoagulations. We'll have to have a discussion about that, depending on what the anticoagulant is. And we may stop ACE inhibitors because they really cause hypotension with the anaesthesia. Option 5 is not true because it says 3 hours and 1 hour.